Hi, I'm Bree. I'll be your nurse today. Can I verify your name and date of birth?
Wade Hamrick, 12/02/1998.
Okay, hand hygiene and privacy. Where are you right now?
I'm in my house.
Okay, and what year is it?
2023.
Okay, who's the president?
Joe Biden.
Okay, and why are you here?
I'm sick.
Okay, can you scoot closer for me?
Yeah.
Okay, so the patient's consciousness is good and they're oriented. There's no obvious physical deformities. The dress is appropriate for where they are, and their grooming is appropriate as well. Not too oily, they're clean. Okay, is it okay if I touch you? Okay, patient's skin color is appropriate for their ethnicity. The facial expressions are appropriate to their reactions. They're alert and they're making good eye contact. Their speech is good and their responses. They can hear me due to them responding to the questions, and doesn't seem there's any vision concerns. Okay, now skin, hair, nails. Okay, I'm gonna touch your head if that's okay.
Yeah, that's fine.
Okay, their hair isn't too oily. They just showered, so it's wet.
Yeah.
Okay, no lesions or anything like that. Okay, have you had any headaches or anything like that recently?
No.
Okay, their skin surface is even all around, it seems. The pigmentation is good, the temperature is warm. It's appropriate for where they are. And then I'll look at your nails. They bite their nails. The nail bed is pink. I'll check your capillary refill. Okay, that's good. Alright, and there's no clubbing or anything like that on their nails. Okay, and then okay, your skin. Okay, the elasticity is good, so they're hydrated. And have you had any like abnormal findings on your skin? The patient is sneezing. Okay. So their moisture of their skin is good. For the brain scale, as far as activities go, they look pretty in shape. And how would you say your nutrition is?
Good.
You eat enough vegetables and stuff?
Yeah.
Okay. Okay, their head and face, I already checked their head. And then I'll look at their face for symmetry. It's symmetrical.
Sorry.
The size is appropriate for their body, and the shape is good. Have you had any headaches or anything?
Yeah, no.
You might in a little bit. Okay, and then their ears, the symmetry is good. We don't have to check their hearing because they've been hearing the questions being asked and responded appropriately. And then the external ear structure.
Oh my gosh.
Okay, everything looks good. They're both symmetrical internally and look how they are supposed to.
Sorry, doctor, can you excuse me, nurse? For just a moment.
I think they went to go blow their nose, so.
Sorry, nurse.
Okay.
You need something to sneeze into.
A towel?
Yeah.
Okay. Have you had any difficulty hearing recently?
No.
No? Okay. Now I'll look at your eyes. So I look at the light response, and before I shine the light, the pupil is round and is about a 5. Okay. And then I look at your other eye. Okay. And the other side is symmetrical, round as well, and about a 5. Alright. So both the pupils dilated with one another or constricted with one another. So that's good. Have you had any difficulty seeing or anything like that? Okay, and now look at the accommodation, so stare at that. And then look at the wall behind me. Okay, the pupils responded accordingly. Okay, so now your nose. Have you had any kind of runny nose recently?
Yeah.
Yeah, okay. So I'll look at the external nose structure. So good, symmetrical, no bumps or anything like that. And I'll look at your nostril patency, so blow out. Okay, the other side. So, the patency is not very good. So yeah, I'll need to note that. Okay, now for the mouth, throat, and neck. So if you can open your mouth and say ah. Okay, it's very moist, so a lot of oral mucosa. And the trachea is midline. Can you swallow for me? Okay, no difficulty swallowing. Have you had like a itchy throat or anything like that recently?
Kind of.
Okay.
I don't think it's from eating, like my
Okay, can you scoot closer?
my tendrils and back of my throat, you know.
Okay.
Whatever those things are.
Okay, so the patient would be at a 45-degree angle. Could you look that way? Like, yeah. Okay, then the other way. Alright. So there's no JVP. And your neurological assessment. So the patient is conscious and oriented. I did that whenever I asked the 4 questions. And then, have you been having any confusion or issues with memory or anything like that recently?
No.
Okay. So now we'll do the respiratory. So respiratory rate. So I would just watch his chest. Okay, the depth is good. The rate looks good. Normal. It's in the normal range. It's not too shallow or deep. And there's not too much effort when breathing, and the pattern is even. Okay, now I'm gonna oscillate your breathing sounds.
I thought they were supposed to do
Huh? Oh. Okay, so your right upper lobe. Take a deep breath for me. Okay, again. Left upper lobe. Okay, left upper lobe again. And your right middle lobe. Okay, now grab your right shoulder for me. Okay, now we're doing your left lower lobe. Okay, other side. Right lobe is. Okay, deep breath. Again. Okay. So all those sound normal. There aren't any abnormal sounds. I'm checking his lungs. So because you're sneezing and all that recently, to make sure you don't develop an abnormal amount of mucus, you'll do the turn, cough, breathe. So if you're laying in bed for a while, after an hour, you'll turn, take a deep breath, and then cough out. That'll help keep the mucus moving. And then you'll have this incentive spirometer.
Okay.
So you'll take deep breath you'll blow for 3 to 5 seconds, and you'll do this 10 times an hour. And this will help move the mucus. So can you demonstrate that for me?
Blow for 10 seconds?
No, like 2 to 5 seconds, 10 times. Okay. Okay, and there's no cough, so there's no sputum present. And have you had any chest pains recently? No? Okay. So now we'll do the cardiac assessment. So I already inspected for the JVP. Now I'll palpate the pulses. So we'll do your radial. Okay, that's a 3+. Okay, 2+, 3+, and 2+. And then now we'll do your feet, so your dorsalis pedis. Okay, that would be a 1+, 1+ on the right foot. And then for your posterior tibial, a 2+ on your left side. And a 2+ on your right side. And then we already did the capillary refill. And now we'll look for edema. Right, no pitting present on the upper extremities. Alright, none on the lower extremities. And now we'll osculate your heart sounds. Okay, so the heart sounds are good. No signs of murmurs. Have you had any chest pains or anything like that recently? Have you felt like or had any difficulty with like blood flow or anything like that? Like got really cold or lightheaded or anything? Okay. So now for your gastrointestinal. When was your last bowel movement?
Last night.
Okay, and are you passing any flatus?
No.
Okay. Okay, so I'll look at your abdominal skin. Is it okay if I expose your stomach?
I guess so.
Okay. Alright, okay, so the abdominal skin looks good. It's all even, no signs of bloating or anything like that. Then I'll osculate your bowel sounds. Okay, so there's movements in all the quadrants. And it's not too much or not too little, so no signs of constipation or any kind of backup. And then I'm going to palpate in all the quadrants real quick. Have you had any stomach pain or anything like that recently? Okay. Alright, all the quadrants feel good. Was there any pain while I was doing that?
No.
Okay. Okay, now I'll do your musculoskeletal system. First, I'll assess your gait.
Okay.
So if you could just get up and walk to that nightstand for me.
All right.
Okay, and then turn, and then go heel to toe while looking at me. Okay, let's step back a little bit. Put your hands out. And then close your eyes. Okay, by your side. And put your feet together. Put your hands by your side. Close your eyes. Okay. You can sit down. Okay, so their gait is appropriate. Their balance is appropriate. And then, come.
Stand.
Fly. And I'll do your range of motion.
Okay.
Okay, so we'll do the elbow. So flex for me. All right, extend. Okay, good. Flex. Extend. Okay, was there any pain while doing that? All right, now we'll do your wrist. Flex your wrist for me. Extend. Hyperextend. Okay, push on my hand. Okay, any pain?
No.
Okay, flex. I'll push it on my hand. Okay, extend and hyperextend. All right, any pain with that one? Okay, and while doing that, I was feeling his joints and there was no signs of crackling. Okay, extend your knee. Okay, and flex. Okay, extend, flex. All right, extend, flex. Okay, now I'll do your ankles. All right, push down on my hand. Okay, up. All right, push down on my hand and up. And when you go up, it's dorsiflexion, and down is plantar flexion. Okay, no crackling, no pain at all during that assessment. Okay. And now for your whenever you've gone to the bathroom, what color has your urine been?
Like yellow, white.
Okay, has it been cloudy or anything? Okay, and no pain while
No.
voiding. All right. Well, you're all good.
Thanks. Good shit, nurse.